Hi, everyone. Welcome to today's webinar on aging and vulnerable populations. Did you know the current growth of the population ages 65 and older, driven by the large baby boom generation, those born between 1946 and 1964, is unprecedented in U.S. history? Today, they remain the second largest generation group, contributing to steady increases in the median age of the population. Catholic Community Services promotes the well-being of older individuals by providing services and programs designed to help them live independently in their own homes and in their own communities for as long as possible. Today's webinar will address some of the programs that support this desire, specifically our adult day healthcare, housing, and nutrition services. The agenda for each of today's presentations includes the program history, funding overview, program challenges, key opportunities and future vision, how to support, and open discussion. Because of the number of programs and presenters that we'll be sharing, we do ask that questions and open discussion be saved till the end to ensure adequate time to present. Your presenters today will be myself, Mary McClendon, Agency Director for Catholic Community Services in Yuma, Melissa Valencia, Property Manager for Barrio Viejo, Elderly Housing, and Kara Melton, Associate Director for Tucson Nutrition Programs. So with that said, welcome again. My name is Mary McClendon, Agency Director for Catholic Community Services Yuma, and I'll be kicking off the presentations with a review of our Daybreak Adult Day Healthcare Program. So a little bit about the CCS for Daybreak. We have Avita Mendez-Counts, the Executive Director for CCS Yuma, myself, and then we have an RN Program Administrator, which the position is currently vacant. We have our contact name, numbers, and emails on here. And I think it's important to point out that even though the RN Program Administrator position is vacant, this is the current and ongoing email address that we use for communication. So there should be no concerns about whether it will get to the right area or not. A little bit about our program history. So Daybreak was established in Yuma County in 1983. We provide community-based respite care so a loved one can remain in their home. Daybreak offers an alternative to nursing home care for those who do not need 24-hour skilled nursing services. We operate Monday through Friday from 7:30 a.m. to 4 p.m. and have full-time and part-time options. Our services include minimally health monitoring, medication assistance, bathing assistance, nutrition services, opportunities for socialization, exercise, and more. We seek to serve adults who need assistance or supervision during the day, with a special focus on older adults who may have the onset of Alzheimer's or dementia. Our staff includes a full-time registered nurse, certified nursing assistants, certified caregivers, an activities coordinator, program aide for nutrition services, and volunteers who come in to assist with companion care and cultural opportunities. Other providers in Yuma County, there aren't any. Daybreak is the only state licensed adult day health care program in Yuma County. And you'll see that I not only emphasize the word only, but the word health. We are the only one certified by the State of Arizona Department of Health Services. And as such, we are a medical model. And that's what differentiates us from the other day programs that are available in the community. So with an RN on site, we're able to do those things that an RN can do and a layperson might not be able to. Specifically, we're looking at some of that health monitoring and the medication administration assistance. So our funding sources, our primary funding sources through contracts with the Western Arizona Council of Government Area Agency on Aging. So thus we are contracted with them. We are also contracted with the Division of Developmental Disabilities, otherwise known as DDD. Also with Arizona Long-Term Healthcare, who is currently contracted with Banner Healthcare. The Veterans Administration, and of course we accept private pay. So what is our impact on policy, especially as it relates to older adults? Services provided in the community, such as Daybreak, delay and can prevent the need for higher level or more expensive, i.e. nursing homes, care paid for by Medicaid, postponing impoverishment and eligibility for means-tested Medicaid long-term care program. What do all those words mean? Simplified, they mean, look at the daily cost comparison of adult care options. The 2022 cost of care survey showed that the national average for nursing home was $284 a day. In-home care, $185 a day. Assisted living, $162 a day. And a day at Daybreak, $75 a day. So that's what we're looking at when we say, can we offer a more affordable way to allow people to live with as much independence and dignity as possible? One of the things that I like to share that sometimes we don't like to hear is, where do we want to pass when it's time? I'd like to be surrounded by my loved ones in their home. And this is what we can support, as well as that respite care that the caregiver needs. So by supporting the health of older adults, by providing in-home and community options, programs and services related to the Older Americans Act saves Medicare, and at the end of the day, the nation money. So current challenge, funding cuts. And Arizona, a return to pre-COVID funding levels. Such cuts are impacted by the rate of inflation and labor costs that have occurred since the pandemic. So minimizing costs without jeopardizing goals, objectives, and safety of the participants becomes critical. Another challenge is increasing our current enrollment. An increase in home health and respite care opportunities during the pandemic resulted in a decreased awareness of adult-day health care options for respite care. So community outreach and education opportunities such as health fairs and workshops and support groups have become increasingly virtual, decreasing person-to-person contact. A horrible example of that challenge is the fact that we currently in Yuma County do not have a support group, live or virtual, for Alzheimer's or dementia. That's telling. So when we look at our program vision and key opportunities, our vision will always be to continue to promote healthy aging by supporting caregivers with respite care services while allowing older adults to continue living in their own home and community for as long as possible. Some ways that we can do that, hopefully, are through new partnerships. We need to increase our marketing and outreach beyond the social services field, including but not limited to assisted living facilities, rehabilitation services, doctors' offices, those people who are serving our target population every day and know who needs that support. We can increase our educational outreach as well. Relationships with key media outlets provide opportunities to educate the community on current aging topics and available services. And increase our partnerships with the local nursing programs. We need to build on our existing externships with local university and community college programs, bring those students and their families and their instructors onto our site so that they become more aware of the aging services that are available in our community. So how can you support our efforts? Policy and advocacy, outreach to local and state elected officials regarding the importance of funding aging programs and caregivers. Caregivers are the unseen patient. Caregivers are the ones that end up tired, sick, and in the hospital because they use all of their energy to care for the person that they love. Donations, program supplies are always helpful and very much appreciated. Art supplies, coloring books, large piece puzzles, lifelike babies, anything that can spur creative thoughts, use their hands, their eyes, support their cognitive development and maintenance, anything to have fun with, essentially. So others, listen to your friends and family and yourself. Recognize that caregiving is a labor of love and indeed exhausting. Daybreak Adult Day Healthcare is here to help you, not replace you. So schedule a tour and check us out. So thank you for joining me today and listening to this. Again, we'll have Q&As at the end of the presentation. And right now I'll pass the mic, if you may, to Melissa Valencia to talk about housing.
Thank you, Mary. Good morning, everyone. My name is Melissa Valencia. I am the property manager at Barrio Viejo Elderly Housing. Michelle Torres couldn't join us today, but she's also she's the housing supervisor, currently the interim property manager at Casitas on East Broadway. To introduce our staff, we do have Terrence Watkins. He's our executive director of housing and medical respite services. Michelle Torres is our housing supervisor. Fred Nunez, important man, he's our maintenance supervisor. Without him, we wouldn't be able to continue on. Myself, I am the property manager in Barrio Viejo. We do have a vacancy for our service coordinator at Barrio Viejo Elderly Housing. And we also have Miss Verma Aldridge, who is the service coordinator at Casitas. Oops, I apologize. Ms. Verma Aldridge is the service coordinator at Casitas on East Broadway. And our program history. Barrio Viejo did open up August 1st of 2003. We have 62 units, which are 1 bedroom and 1 bath. We do have our Casitas on East Broadway. They opened in August of 2010, and they have 57 units, 1 bedroom, 1 bathroom. Now we do house the senior community. You do have to be 62 years of age or older. You must be able to live independently. And in order to apply to get onto our waiting list, you just need to give either Casitas on East Broadway or Barrio Viejo a call, and we can mail out an application to you, submit that with the required documentation, and we'd be able to add you to the waiting list. Currently, the waiting list at Casitas on East Broadway is 2 to 3 years long, whereas at Barrio Viejo, we are closer to the 3 to 4 year range for the waiting list. Now, the way our funding works is each resident is responsible for 30% of their monthly income to go towards their monthly rent. And so currently, Barrio Viejo, we have a contract market rent of $926 a month. Casitas on East Broadway is at $614 a month. So once we complete that adjustment, the resident will pay their 30%. And HUD will come in and pay the remaining of that market rent. That rent does include their housing. It includes their utilities, which includes electricity and water and garbage pickup. So at the moment, in order to qualify, a 1-person household cannot make more than $31,250 annually. That's about $2,600 a month. A 2-person household cannot make more than $35,750 annually, which is about $2,900. So currently, as with everyone else, our challenge is finding that funding so that we could provide the different activities for our residents. In order to accommodate that, we are providing new services as of June 1st. We're still in the process where we are providing transportation to our residents, whether it be to the grocery store, doctor's office visits. We're going to assist with applying for additional benefits. If a resident wants to go back into the workforce, we're going to help them find that job that they would like to do. If they want to go back to school, we're going to assist with that as well. In addition to financial budgeting, financial literacy. Currently, we do have coffee hour in the morning where they discuss current events. We have the University of Arizona Garden Kitchen who comes in and helps with gardening. We have gardens across both properties where we do grow our own cilantro. We have onion, green chili. We do have an arts and crafts weekly, and we are hoping to increase our physical activity and include any game day activities, game boards, board game, checkers, puzzles. So how can you support our housing services? We do have a board of directors, which we are looking for members always. So if you are interested in joining 4 meetings per year, please contact Michelle Torres at Casitas on East Broadway. We do accept donations. We do have volunteer opportunities. Whether you want to teach an exercise class, yoga, you want to help the residents with some of the gardening we have here. If there's an art or a craft that you would like to teach to the residents, we would appreciate that as well. Financial donations, those would go towards our field trips, activities, supplies for our activities. We do have cookouts for our different holidays. If there's a presentation you would like to show to our residents in regards to aging in place or anything health related, we also welcome that. Donations of goods, art supplies, houseware items, because sometimes they do move in with nothing really. They need many things when they do move in at times. And if you have any other questions, you can always give us a call at the office, and information is up on the screen. And again, questions and answers, discussion, we'll do that at the very end. With that, Ms. Kara, it is your platform.
Thank you. Thank you everyone for joining us. My name is Kara Melton. I am the Associate Director for Tucson Nutrition Services. I have my office manager, Rosalie Martinez, who actually helped me put this together, so thank you. And we are located at our main nutrition office, which is on 5009 East 29th Street. So our program history, we do provide frozen home delivered meals to those that are homebound and have no resources. We also provide hot meals to congregate sites across Tucson, Green Valley, and Ajo to participants who are over 60 that are able to get to the center and want some socialization. So our CCS drivers deliver frozen meals to eligible clients, and eligible clients are those that are homebound, over 60. They have no available resources to them. They are not able to cook or shop for themselves, so they need our help. So we provide 5 meals a week to those that are eligible. We also have a congregate program, and our congregate drivers deliver hot bulk meals to about 20 centers across Tucson, Green Valley, and Ajo as well. We contract with the Caridad Kitchen, and a consultant RD helps to develop all of our menus so that they are nutritious. They are considered a third of the recommended dietary allowances for the day. So they get entree, sides, fruit, a salad, milk, bread. It's a complete meal, and it's considered 1 meal per day. I have about 23 staff members in Tucson and Ajo, 10 drivers, 3 case managers, a program coordinator for the centers, 5 site managers. I have 2 cooks, and then 1 office manager and myself. Like I said, population served is mostly over 60. We do provide some services for under 60 with disabilities. We have some limited funding for those that are under 60. We do partner with Pima Council on Aging, PCOA, to fund this program. And we do have some FEMA funding coming in for temporary services for our home delivered clients who are out of the hospital and need meals for a short amount of time. And I also receive a OA grant through Pima County for our Quincy breakfast. So, like I said, our funding, Pima Council on Aging provides, is my main funding provider. So in conjunction with them, I have a contract for the home delivered meals and the congregate meals. And those are billed monthly for all related expenses. I do have additional revenue coming in from catering. So I have about 10 sites throughout the city that I contract with, that my driver picks up the meals and delivers to the city sites, and they have the lunch meal. I also have several sites in Green Valley, and then Chicanos por la Casa at Del Encanto. We deliver there as well. It is a fee for service basis, so every month I bill them for the meals that we provide to them. So current challenges, just like everyone else. During COVID, we were able to increase our funding. We got emergency funding. We brought a lot of people onto our program because everyone was isolated, everyone was homebound. And we also gave them extra meals. They got 7 days of meals every week. So once that funding ended, we had to decrease to 5 meals a week. And we had to really find out who was actually homebound. So eligibility requirements, we had to buckle down a little bit. And a lot of it was natural attrition. People called, they can drive now, they're going to the grocery store. So they took themselves off the program. As of January 1st, we had to decrease and put everyone on a wait list. We had until about April to try and take a couple hundred people off the program. And then we could start bringing people back on. So that's where we're at right now. We are now adding clients back onto our routes. So that's a good thing. Hopefully we can stay where we're at and continue to provide services to people that need it. We are working closely with PCOA to continue to fund the program, and also trying to find other funding sources through grants and donations as well. Opportunities, through marketing and word of mouth, we would like to try and grow our congregate program. We have a real opportunity to get seniors out of their house, if they're able to come to a center, play cards, bingo, all the things that even, reading, just talking to people. It really makes a huge difference in their socialization. They're not so isolated. So we're really trying to get that word out and get people to the center. So, and that's, we're going to just try to continue to provide good services for our seniors. You can help to support. We're always looking for an increase in the funding for the program. Volunteer opportunities. We at the centers, we use a lot of our participants as helpers. So you go, you get a meal, and then a lot of them will help to clean up. They'll help set up. There's a lot of help there. So we're always in need of helpers there. And donations. The greatest need for donations is in the home delivered meal program. So if you know anyone that would like to donate money to maybe support a few more people that can get meals, that would be great. And then, yeah. And then I guess next will be Mary McClendon. She'll be talking about the Yuma Nutrition Services. Thank you.
Thank you, Kara. So yes, Yuma has its own senior nutrition program. And again, you see Avita and myself there. But we also have Cynthia Lopez, who is our site manager at the center, and she oversees essentially the daily operations there, ensuring that our kitchen staff has everything that they need to be successful in creating all of the meals, and working the partnership with our home delivered meal staff and the drivers to ensure that they have everything that's needed for delivery. And along those lines, we have Celia Armas, who is our service coordinator, and she is responsible for creating all of the routes that our drivers go on, making sure that all of the participants are placed accordingly, eating hold for meals because of somebody being in the hospital or on vacation or whatever the case may be, are placed and then lifted when they're ready to resume their meal delivery. And of course, their contact information is here on the slide. So a little bit of program history for our home delivered meals, AKA Meals on Wheels program. In fiscal year 23, CCS Yuma home delivered meal drivers drove over 64,000 miles to deliver over 73,000 meals to homebound individuals throughout Yuma County. So definitely an undertaking. The program was established in 1983. Home delivered nutrition services enable older adults to avoid or delay costly long-term care options, and again, allow them to stay in their home and in their community. We provide doorstep delivery of nutritious hot and cold meals designed to meet 1/3 of the recommended dietary reference intakes. We're menu-based, like Kara's, it is approved by a registered dietitian. And we take pride in sharing the fact that we don't repeat an entree in over 6 weeks of our menu cycle. So no complaints that we serve the same thing every day. A participant can receive up to 7 meals per week. It's based on their individual assessment, and we schedule deliveries 3 times a week to their home. Our population served is, our target is homebound individuals 60 years and older, and we do have limited funding available for spouses and eligible individuals under 60 with a disability. Our staff and volunteers include our service coordinator, our volunteer and paid staff drivers for meal delivery. And again, we take pride in sharing that our volunteer driver has been on board for over 20 years. Other providers, we are the only local provider of Meals on Wheels in Yuma County. I do emphasize the word local because there are mail delivery systems available, but those are very few and far between throughout Yuma County. And so we essentially become the only provider of home delivered meal services. Our Congregate Meals program was also established in 1983, and it's designed to improve a participant's physical and mental health through nutritious meals, opportunities for socialization, and evidence-based health education. Hot and cold meals designed to meet the same thing, 1/3 of the recommended DRIs, menu-based and no repeating entrees. This is for individuals who can come to the center and eat with us. So we serve lunch Monday through Friday, 11 a.m. to 12 noon. And we also provide a light breakfast between 8 and 8:30 a.m. Our target population is 60 years and older who are able to attend lunch at the center and their spouse, regardless of age. And again, we have limited funding available for eligible individuals under 60 with a disability. And our staff and volunteer includes a site manager, 1 lead cook, and 3 kitchen aides. So those 4 individuals in the kitchen were responsible last year, fiscal year, for preparing over 85,000 lunches and 5,300 breakfasts. Other providers, South County, Somerton, and San Luis, Arizona, each have a senior center in their community, and they provide congregate lunch at their centers, but again, they do not do home delivered meals. So program funding, our primary funding source is through contracts with the Western Arizona Council of Governments, the Area Agency on Aging. The Arizona Long-Term Healthcare System. And we pay as well. Is mainly funded through WACOG again, the Area Agency on Aging. And it's important to note down here at the bottom of this slide is there is no charge to a participant for meals received in either program. A donation of $2 per meal is suggested, but it is not required, nor do we track whether you make it or not. So the impact of our services on policies is that services provided in the community, such as the senior nutrition program, can combat social isolation and nutritional deficiency in older adults. And this supports a healthier aging process and can minimize re-entry to hospitals by providing ongoing nutritional sustenance when they come home. Support the health of older adults by providing in-home and community options, programs, and services funded through the Older Americans Act, which we mentioned earlier, can save Medicare and, at the end of the day, the nation money. So our current challenges, funding. Anticipated budget cuts, again, indicate a return to pre-COVID funding levels. Such cuts are impacted by the rate of inflation, especially with food costs and labor costs that have occurred since the pandemic. Our anticipated cuts in funding represent a 50% decrease in the number of home delivered meals funded. So 27,000 meals less than the prior fiscal year, or over 100 homebound participants. So our program is faced with balancing the potential need to decrease the amount of weekly meals a homebound participant can receive with the rate of natural attrition to minimize the impact. We now have implemented service holds, so all new requests for services through WACOG, our largest referral source, are placed on a wait list. And the anticipated wait time is a minimum of 6 months. So what is our vision? Of course, it's to continue to support older adults with nutritious meals designed to maintain their health, independence, and ability to age in their own homes and communities. We can do this by looking for alternative funding, continue to research and secure alternative grant funding to supplement current shortfall and continued sustainability. We can look at expanding our donor base to develop long-term private donors designed to supplement current shortfall and continued sustainability. And we can increase our advocacy efforts. We need to build on those efforts to raise critical awareness and support for senior nutrition programs to protect and strengthen the funding. So how can you support? First and foremost, of course, is always policy advocacy, outreach to local and state elected officials regarding the importance of funding aging programs and nutrition services. I don't think they realize the extent of, I don't want to say damage, but damage that the level of cuts that we receive are providing. So donations, our primary need is financial, creditable food source donations to offset cost, driver support volunteers. Other, pick your passion. The Congregate Lunch Program always enjoys social events. So do you play music, have a hidden talent you can share, want to sponsor a social or holiday event, want to serve meals and visit with participants, give us a call. There's always something to do. And again, thank you for joining us. So thinking forward, where are we going from here? So when we talk about a continuum of care, CCS has proclaimed an ongoing commitment to serve older adults. And one of those ways, that we look at is the fact that elderly homelessness at one point was seen as a rare occurrence within the contemporary homeless problem, but it is becoming arguably the fastest raising group in new homeless cases. And so with that in mind, CCS will look at building on the current existing continuum of care to address the needs of older adults who are experiencing homelessness. So I think that's all we have. We are open for discussion or questions if anybody has anything.
This is Laura. I have a question. Is there a waiting list? And if so, how many people are waiting?
A wait list for which program would that be, Laura?
Nutrition in home?
So for the human nutrition program, I can say that there is a wait list. The challenge in knowing how many people are on there is that it is maintained through WACOG. And the way that they are running it is that they are putting everybody on a wait list for case management services because they have placed all of their programs except for Daybreak on a wait list. So they haven't figured out a way, or they haven't started the process of isolating which program that they're asking for. Kara, you could speak to your program.
So for us, we do have a wait list, and like I said, we work with Pima Council on Aging. So they're sending me everyone that we have on our wait list. Case managers will screen everyone, do the application process, do a home visit, send it to Pima Council on Aging, and then we get back a priority list. So the highest scores, it's based on highest need and date. And then it's up to me to put people into which case manager and what route. And so we don't have very many. We've been working down our wait list. We probably have about 30 people maybe on our wait list right now. So it can be anywhere from a month to 6 months wait, just depending on need, how much they truly need the meals. So.
Mary and Cara, this is Patsy. I have a quick question on the cost per person to feed a senior for a year. I don't know if it would be different in Yuma than Tucson, but just curious as to what that dollar amount might be.
Good question.
So I can tell you, Patsy, for Yuma County, I'm going to give you the rough estimate. It's roughly $2,000 a year to feed or to provide meals for one participant for 12 months. And we base that on a 23-day month because most of our participants are receiving meals 5 days a week. And so that would be 23 weekdays in a calendar month. So if we multiply that out, it comes out to be about $2,000 a year.
Yeah, I think mine is about the same. I think we're about very similar.
Hi, this is Sophia Harris. I've got a question. Let me hand. I think this is for the Pima area for Tucson. When you talked about the respite and the day programs, so do they have to qualify for that? So if they're like on Medicare or Medicaid, I can't remember, would they qualify to be able to attend like a day program? Or even for the people who are having to care for the aging person and have some respite services? Like, is this an option?
So Kara, I don't believe that you have day programs in Pima County.
Correct. So the congregate program, they can be there from 9 to 2. They can come in and basically stay there all day. They have a meal and they can do some activities, but it's not considered a day program per se.
Oh, okay. So they could just
Yeah.
go there and participate in the activities with everyone else. And you said it's not in Pima County, or it is in Pima County?
My programs are in Pima County. Yeah, I have
Okay.
congregate centers all around the city. So
Congregate
Yeah.
centers is what it's called. So if
Yes.
clients have like questions about that, do they who would they contact to get
So
more
they can-
information about these
they can
places
can call my office, the nutrition office. Information is on the Pima Council on Aging website. It's also on the CCS website. So
It's on the CCS website?
yes,
Okay. Cara, are you with CCS?
yes,
Okay, so I could find you then.
yes.
What's your last name?
Melton, Melton.
Ewan. All right, perfect. Thank you.
I just like to say it was a really informative, all three of the presentations, really great. I have a silly question for Mary. What is a virtual pet?
I just hit my camera. Sorry about that, Mary Ann.
Oh, you're upside down.
I can hear Avita over there now going, oh, there she goes with that camera. So a virtual pet, if you have the opportunity to visit our Facebook page for Daybreak, you'll see some pictures with it. It is a battery operated cat or dog that actually barks or meows, cuddles, pants, and does all of that kind of stuff. And so when we're working with adults and trying to do cognitive maintenance or memory recall, those who have those onset of dementia and Alzheimer's diagnoses, they are companion pets. And so you will find them trying to feed them, or brushing their hair, just cuddling, listening to them bark, and being able to have a pet that they can maintain in their own space. If you look up virtual pets, Marianne, online, there's an app.
Okay, thank you. Well, and I assume the website also for any of these programs includes information on opportunities to donate for either, as you said, you need supplies, obviously you need money, but supplies and volunteer activities. I hope those are on the website as well as just basic information about the programs.
I'm sure that our websites are fully developed to that. I know they've been undergoing some maintenance and structuring. So I think we're building up to some of those opportunities. I'm not sure that we're there yet. That's out of our 3 pay grades.
This is a programs that are so critical right now as families try to work and try to balance taking care of elderly and being squashed in the middle on generations and things like this. So it's a wonderful umbrella of programs.
Thank you. We agree.
This is Patsy again. Mary and Kara, if you would send me a copy of your slide that is the donation piece, that is something that I can put on my St. Jugan flock note. And it is something that I can include in the folders that I give folks for workshops. In fact, I'm trying to do a fast gather of our CCS units. I have the big convocation July 20th. My hope is to have 200 people there. I had 168 last year. So, but that is a way that I can offer to get this out, especially since I am a ministry with elders and people are always asking me, what do the elderly in the communities need? And I tout the Daybreak program quite a bit. I wish we had that here in Tucson, but I love that we have the congregate meals here in town. So if you folks will send me that, I would greatly appreciate it. When we get off, I'll send you my email just in case you don't have it.
Absolutely, thank you. It sounds like we're done. Any other questions or comments? Well, then I'll take the lead, and ladies, you can follow. I'm saying thank you again to everybody for showing up and participating. Appreciate you taking the time to learn about all of our programs and ways that you can contribute and help.
Yes, thank you. Thank you, everyone, for participating and listening. Happy Friday.
Thank you so
everyone. Have
much.
a good weekend.
Thank you.
That's
Have a-
excellent. Thank you.
A great weekend.
Yes.